Hey Earthlings, let's talk about my dermoid cyst, a teratoma dermoid cyst found in my right ovary. The most common complications, injury to the spinal cord or nerves, which I can say I've experienced some trouble with those things and being able to walk and so forth. Rupture, bursting open of the cyst, that has not happened yet because if it did, there would be infection and I would have had like 3 days to live before they did something. I was told recently that on the ultrasound, my teratoma has become calcified. So the calcification could prevent infection or a rupture from fluids leaking, etc. But when leaking can cause GI issues, leaky gut, etc. Then the other most common thing is twisting of the ovaries or ovarian torsion, which I will get into right now. Ovarian torsion, fallopian tube torsion. Twisting causes sudden severe pain and often nausea and vomiting. Doctors use an ultrasound device inserted into the vagina called a transvaginal ultrasound to aid in the diagnosis. Surgery using percussion, however you say that word, is
Laparoscope, a small tube-shaped microscope with a light on the end, is passed into your abdomen so the surgeon can see your internal organs. The surgeon then removes the cyst through the small cuts in your skin. After the cyst has been removed, the cuts will be closed using dissolvable stitches.
It's done immediately to untwist the ovary or to remove it. I've been really sick for the past year and a half. The question, how sick can an ovarian cyst make you? Cysts that become large can cause the ovary to move. This increases the chance of painful twisting of the ovary. Ovarian torsion. If this happens, you might have sudden severe pelvic pain and nausea and vomiting. Ovarian torsion can also reduce or stop blood flow to the ovary. At this point, whenever I become super sick, I go to the ER as long as there's not blood flow being stopped. Even if I am experiencing torsion, because recently I had a better experience with a sonotech when she told me that it's typical for the reproductive system. The whole thing can shift. It's meant to shift, especially during pregnancy. That's why we see it moving. You can get an introverted uterus or retroverted uterus, one that's tilted forward or back, things like that. Basically, anytime I get really sick and I go in for these issues that the dermoid cyst is causing, as long as that it's not twisting so much that it cuts off blood flow, they're just not going to remove it yet until some other, like I said in past videos, other conditions are resolved. They will then remove it then. So I just have to deal with the symptoms as they come, which is frustrating because I've already been dealing with these for so long, and I wish they would have been treated when they saw it the first time. Like